Welcome to the UC Retiree Health Benefits webinar. This presentation is intended for UC employees who are nearing or considering their retirement, or UC retirees who want to better understand UC retiree health and the transition to Medicare. In this webinar, we will provide an overview of the UC retiree health benefits, as well as tools and resources to assist you through the transition to UC retiree health. In addition to the Retiree Health webinar, the UC also offers two additional UC retirement planning webinars. Preparing for Retirement, which provides a comprehensive overview of UCRP, and the UC retirement process from start to finish, which guides you through how to prepare and elect your retirement in the UC RACE system. There is no limit to how many times you attend these webinars, and attending more than once can be helpful as you prepare for retirement. More information, including registration details about these webinars, can be found on UCNet. In this webinar, we will begin by reviewing retiree health eligibility and retiree health groups and premiums. Next, we'll discuss Medicare and UC and how they coordinate, your transition to retirement and beyond, and conclude with a high-level overview of the cost of care under the UC Medicare plans. Let's begin with eligibility. As an important part of our retirement benefits, UC is committed to offering ongoing retiree health benefits to those who qualify. It is important to know that these benefits are separate from the retirement pension and are not a vested benefit. This means plan designs can change from year to year, and UC's contribution to these benefits may change or be discontinued at any time, which impacts your share of the costs. Retiree health and welfare benefits can include medical, dental, legal, vision, accidental death and dismemberment, and pet insurance. In general, you may keep most of the plans you had as an employee. To be eligible for retiree health benefits, you must meet the following criteria. You must be enrolled or eligible to be enrolled in UC employee benefits. You must have 10 or more years of retiree health service credit, and you must elect a monthly retirement income. If you elect a lump sum cash out, you do forfeit retiree health benefits. You must also have a retirement date within 120 days of the date you separate from UC employment. And you must have continuous coverage until your retiree eligibility begins. If you leave the UC and you're rehired after a break in service, you must work at least 12 months in an eligible position in order to be eligible for retiree health benefits. Family members you enrolled as an active employee may continue to be covered in retiree health. This includes a spouse, domestic partner, children up to age 26, grandchildren, legal ward, or over-age disabled child, provided they've been certified by your medical plan prior to age 26. Now let's take a closer look at retiree health groups and premiums. Cost for UC retiree health is determined by a variety of factors: your retiree health group, retiree health service credit, the UC's contribution, which is determined annually, the percentage of the UC contribution for which you're eligible to receive, the medical and dental premiums charged to UC by the plan, who you are covering, and whether or not you are eligible for Medicare. Let's take a closer look at the UC retiree health groups. UC has 3 retiree health groups, and eligibility is based on the date you first became an active member of UCRP or Savings Choice participant, or based on the date you were rehired in a UCRP eligible position after a break in service of more than 120 days. If you are eligible for retiree health benefits, your retiree health group is going to determine what portion of UC's contribution you're eligible to receive towards retiree medical and dental premiums. We'll explore each of these groups in more detail. The next factor in determining retiree health eligibility is retiree health service credit. Anytime you're a member of UCRP or participating in the Savings Choice program, you earn retiree health service credit. UCRP and Savings Choice service credit are both earned based on the percent time worked in an eligible appointment. The retiree health service credit earned will be used to determine your minimum eligibility requirements and the percentage of UC's retiree health contribution for which you are eligible to receive. If you separate from UC employment and you elect a refund of your UCRP accumulations and/or elect a full refund of your Savings Choice DC plan balances, you do forfeit the associated service credit. Let's take a closer look at each of the retiree health groups, beginning with Retiree Health Group 1. Group 1 includes members actively enrolled in UCRP prior to January 1, 1990, with no break in service of more than 120 days. Group 1 members are eligible for 100% of the UC contribution toward retiree health. Retiree Health Group 2 includes active UCRP members between January 1, 1990 to June 30, 2013, or members rehired during this period following a break in service. The UC's contribution ranges from 50 to 100% under Group 2. Members' eligibility under Group 2 is subject to collective bargaining. Please refer to your collective bargaining agreement for more information. Group 2 members are eligible for 50% of the UC's contribution toward retiree health if you have 10 years of UCRP service credit or your age and service credit equals 75. UC's retiree health contribution then increases by 5% for each whole year over 10. With 20 or more years of UCRP service credit, you are eligible for 100% of the UC contribution toward retiree health. Retiree Health Group 3 eligibility includes active UCRP members or Savings Choice participants enrolled with an entry or re-entry date on or after July 1, 2013, or rehired after a break in service. Please note that safety members hired on or after July 1, 2013 fall under Group 2 eligibility. Under Group 3, UC retiree health contribution is based on your age and service credit at retirement. If you have a minimum of 10 years service credit and you retire at age 56 or older, then you are eligible to receive a UC contribution between 5% to 100%. If you have 10 or more years of service but retire prior to age 50, you will receive no contribution from UC toward retiree medical or dental benefits. The minimum UC contribution toward retiree health begins at 5% at age 56 and caps at the maximum percentage at age 65 with 20 or more years of UCRP service credit. Here's an example of the Retiree Health Group 3 chart, which displays the percentage of UC's contribution toward medical and dental premiums. Again, under Group 3, service credit and age at retirement are in whole years only. As you can see from the chart, at the minimum age of 56 years with 10 years of service credit, you would receive 5% graduated eligibility of the UC contribution up to a maximum contribution at age 65 with 20 or more years of service credit. For more information about each of these groups, please review the Retirement Handbook, which can be found on UCNet or scanned using the QR code. Let's look at an example of how the UC's contribution is applied to medical premiums for retirees eligible for 100%, 75%, and 50% of the UC contribution. In this example, the premium for a self and adult enrolled in UC Blue and Gold is $1,800 per month. Let's say the UC's contribution toward medical is $1,000. If you're eligible to receive 100% of the UC's contribution, your medical cost would be $800 per month. If you're eligible to receive 75% of the UC's contribution, then your premiums would be $1,050. And if you're eligible for 50% of the UC's contribution, your premiums would be $1,300. You can find more information about the retiree medical plan costs on UCNet by scanning the QR code. Medical premiums work in the same way as medical premiums. In this example, the monthly premium for Delta Dental PPO for retiree and family is $100. UC will pay the full dental premium for retirees eligible for 100% of the UC contribution. If you have graduated eligibility, then your premium costs will be adjusted based on the percentage amount you're eligible to receive, and you pay the difference. Enrollment in medical, dental, and legal premiums is part of the retirement process. Once enrolled, premiums are automatically deducted from your UC pension. Vision, accidental death and dismemberment, and pet insurance are voluntary at retirement. This means you decide whether to continue this coverage at retirement or not. If you wish to continue coverage, then you enroll in these plans separately at the time of your retirement, and you pay the premiums directly to VSP, Prudential, or Nationwide. We'll take a closer look at both Medicare and UC requirements and how Original Medicare coordinates with the UC Medicare plans. One of the most important things when transitioning to retiree health is understanding both Medicare's requirements and UC requirements. Medicare eligibility is based on your own work history or that of a current, former, or deceased spouse. If eligible for Medicare Part A for free, you must enroll in Part B. Medicare starts the first day of the month you turn 65 for most. UC requires all retirees and family members to enroll in Medicare if eligible. Coordinating your UC Medicare plan with Medicare helps sustain the retiree health program. Original Medicare is a federally funded program made up of 3 parts: Part A, Part B, and Part D. The Social Security Administration controls enrollment in Medicare's Part A and B. If you're receiving Social Security income, your Medicare premiums will automatically be deducted from your Social Security income check. If you're not receiving Social Security income, then your Medicare premiums will be billed to you in 3-month increments. How do you qualify for Medicare? Most people become eligible for Medicare under their own work record at age 65. You qualify by paying into Medicare for 40 quarters, which is about 10 years. Some people may become eligible for Medicare under age 65 if they're disabled or have end-stage renal disease as determined by the Social Security Administration. If you do not qualify, you must provide the RASC with proof from Medicare. However, you may qualify under your current, former, or deceased spouse, generally if you were married for at least 10 years. If your spouse is not yet age 62, you must remember to reapply when they reach 62 to avoid penalties. Medicare is a federally funded program that is made up of 3 parts. Part A is hospital insurance, and this is financed by payroll taxes. If you're eligible to receive it based on your own or your spouse's contributions during employment, then you do not pay a Part A premium. Part B is medical insurance. Under Part B, you do have a monthly premium, which is typically deducted from your Social Security income check if you're receiving Social Security, or billed to you directly if you're not yet receiving Social Security. Part D is prescription insurance. Most retirees do not pay an extra Part D premium. However, if you have a higher income, you may be subject to a higher Part B and Part D premium. Now, I did not mention Part C. Part C is not a component of Medicare, but a type of Medicare Advantage plan that we will discuss later in the presentation. Premiums are determined by CMS and updated and released annually. The calculated premium is based on your modified adjusted gross income as reported on your IRS tax return from the previous 2 years. This means the 2024 premiums are based on your 2022 tax returns. The standard Part B premium is $174.70. This applies to folks who earn less than $103,000 filing an individual tax return or less than $206,000 and filed jointly. If you qualify for the standard Part B premium, then you will not have a Part D premium. If your income is more than $103,000 filing individually or more than $206,000 filing jointly, then you would be subject to a higher Part B premium and a Part D premium. Medicare premiums are determined by CMS and updated and released annually. The calculated premium, again, is based on your modified adjusted gross income as reported on your IRS tax return from the previous 2 years. Again, this means the 2024 premiums are based on your 2022 tax returns. In 2024, folks who earned less than $103,000 and filed individually or less than $206,000 and filed jointly qualify for the standard Part B premium of $174.70 and do not pay a Part D premium. If you have a higher income, then as you can see from the chart, you will be subject to a higher Part B and Part D premium, which caps out at $594 for Part B and $81 for Part D. A common question we receive is how come we need both Medicare and UC Medicare coverage? Original Medicare pays for most but not all healthcare services and supplies. The UC Medicare plans help offset the cost of services under Original Medicare. The UC offers both Medicare Advantage plans, also known as Part C plans, and Medicare Supplement plans, also known as Medigap plans, which coordinate with Original Medicare to help offset the cost of services under Original Medicare. UC Medicare Choice PPO, administered by United Healthcare, and Kaiser Senior Advantage, administered by Kaiser Permanente, are the UC Medicare Advantage plan designs. UC Medicare PPO, UC Medicare PPO without prescription coverage, and UC High Option, administered by Anthem Blue Cross, are UC Medicare Supplement plans. We'll review the differences between a Medicare Advantage plan and a Medicare Supplement plan design in more detail in the cost of care section. For retirees who live or move outside of California and whose family members are also enrolled in Medicare, qualified for the Medicare Coordinator Program administered by VIA Benefits. We'll cover each of these plans in more details later in the presentation. As you can see from the chart, the UC non-Medicare plans are the same as the employee plans. If you or your family members are not eligible for Medicare at the time of retirement, then you'll simply remain in your current employee health plan. If you or a family member is eligible for Medicare at the time of retirement, then you'll transition to the partner Medicare plan at the time of your retirement, except for folks enrolled in the health savings plan. If you are enrolled in the health savings plan and one of your family members ages into Medicare, you must switch to a plan that has a partner Medicare plan. If you're 65 or older and still working, there are some things that you can consider when you become Medicare eligible. UC employees and spouses have the option to enroll in Part A and delay enrollment in Part B and D until retirement. This is not required, and there are some exceptions. If you're drawing Social Security, you will automatically be enrolled in Parts A and B at 65. If you're not drawing Social Security, you may enroll in Part A. If you enroll in Part A while working, you'll want to delay enrollments in Parts B and D until you retire from UC. For most, there's no cost for enrolling in Part A, and it can help pay as a secondary to your UC employee medical plan. Exceptions to this rule apply to employees enrolled in the Health Savings Plan and domestic partners. Health Savings Plan members must delay enrollment in all parts of Medicare until retirement, as the IRS does not allow you to contribute to a health savings account while enrolled in Medicare. Medicare also has different rules for domestic partners. If you have a domestic partner, they will need to contact Social Security before their 65th birthday for information on when to apply for Medicare. If you have questions, please contact Social Security directly for more information. Active employees who will be aging into Medicare or are 65 and older and plan to continue working for the UC beyond age 65 can find additional information and resources about Medicare while working on the Understanding Medicare page on UCNet. What happens if I'm 65 and older and retiring? If you're 65 or older and retiring from the UC, you will want to self-identify on your Personal Retirement Profile, PRP, in the UC Raise system. RAS will then send you a Medicare letter, which will include instructions on how to enroll in Medicare. This letter will include information on the CMS L564 form, in which you and the UC attest that you had credible health coverage through the UC beyond age 65. Once you're enrolled in Medicare, you and any eligible family members will need to complete the appropriate UC medical plan form provided in your packet. Here's a screenshot of how you would self-identify in UC Raise. If you're eligible for retiree health insurance, on the insurance screen in the UC Raise wizard, you'll be able to review your retiree insurance details as well as select the Medicare eligible checkbox on the screen to receive a Medicare packet. If you or your spouse turned 65 while you were still working, you'll be required to complete the CMS L564 form. This is to attest that you and your spouse had a credible health plan through your employer. You can complete the CMS L564 form on the Social Security Administration website, or you can print it and take a copy to your local benefits office or healthcare facilitator who can assist you in completing the form. You'll need to complete this form even if you or your spouse are already enrolled in Part A. If you are turning 65, within 3 months of the start date of your UC retiree health benefits, you can enroll with Medicare during your initial enrollment period and do not need to complete this form. Retirement from UC allows you to apply for Medicare Parts A and B without penalty during what is known as a special enrollment period. If you're receiving Social Security income, you'll automatically be enrolled in Parts A and B. If you're not receiving Social Security income, you'll need to enroll in Medicare approximately 2 months before your retirement date. You can do this by creating an account on the Social Security website and signing up for Parts A and B or Part B if you're already enrolled in Part A. You will need your Medicare card information to complete the UC UBEN form to transition to a UC Medicare plan. Let's look at the UC medical forms you'll need to complete if you or a family member is Medicare eligible at or after your retirement from the UC. If you are enrolled in UC Blue and Gold HMO and you or a family member is eligible for Medicare at retirement, you'll need to move to the UC Medicare Choice Plan and complete the UBEN 121 form. Medicare eligible folks enrolled in the UC Care PPO or UC Core PPO plans will need to complete and submit the UBEN 123 to coordinate coverage under the UC Medicare PPO plan. And finally, folks enrolled in Kaiser HMO will need to move to Kaiser Senior Advantage and complete the UBEN 127 form. When completing these forms, you'll need to include a copy of your Medicare card or Medicare award letter showing enrollment in both Medicare's Part A and B. Non-Medicare eligible family members would simply remain in the non-Medicare partner plan. The UC Health Savings Plan does not have a Medicare partner plan. This means if you're enrolled in this plan and you or any covered family member are eligible for Medicare, you will have to switch your entire family to a new plan that offers a Medicare partner plan. To do so, you'll need to complete and submit the UBEN 100 form along with the appropriate Medicare coordination form, UBEN 121, 123, or 127, depending on which plan you choose above. Each family member eligible for Medicare will need to complete a separate form and submit it to the RASC along with a copy of their Medicare card. If you turn 65 after retirement, RASC will notify you approximately 3 months before your 65th birthday and send a Medicare letter which will include information and instructions on applying for Medicare. Again, if you're receiving Social Security income, Social Security will automatically enroll you in Parts A and B. You will then need to complete the appropriate UBEN form and send it to the RASC. If you're not yet receiving Social Security income, then you'll need to enroll in Parts A and B with Social Security and then complete the appropriate UBEN form and return it to the RASC. If you're not eligible for Medicare, you must provide proof of ineligibility to the RASC. Let's look at a summarized timeline of the transition to Medicare for you and your eligible family members at the time of your retirement. This timeline also applies to retirees and/or their family members who age into Medicare after they've retired from UC. You apply for Medicare's Part A and B with Social Security. Social Security will confirm your enrollment and send you a Medicare card. Once you've received your Medicare card, you'll need to complete the UBEN form and send it to the RASC. Once RASC has received your information, they will send your updated information to the insurance carrier. The insurance carrier will then send you your new insurance ID card, and you will provide this card to your doctors and physicians. What happens now that you're enrolled in Medicare? Medicare becomes your primary insurance at retirement, and it is at this point that you will need to transition to the partner UC Medicare plan of your current plan. Again, the UC Health Savings Plan is the only plan that does not have a UC Partner Medicare plan, so you'll need to switch to a UC plan that does include a Partner Medicare plan. Most of the UC Medicare plans already have a Part D prescription drug component. This means you do not need to enroll in a separate Part D drug plan. If you do enroll in a separate Part D drug plan, you may lose your UC-sponsored Medicare coverage, as Medicare only allows you to be enrolled in one Part D drug plan. The UC Medicare PPO without prescription drugs is the only plan that does not include Part D prescription drug coverage. If you enroll in the UC Medicare PPO without prescription drugs, then you must enroll in a separate Part D plan that meets CMS requirements of credible coverage and provide proof of enrollment to RASC. Once you're enrolled in the UC-sponsored Medicare plan, you may be eligible for a Part B reimbursement if the UC contribution exceeds the cost of the plan. If you qualify for a Part B reimbursement, the reimbursement will be added back to your UC pension. As mentioned previously, some retirees may be eligible for a Medicare Part B reimbursement. A Part B reimbursement applies if the UC contribution exceeds the plan premium cost. This chart illustrates an example of medical premiums when coordinated with Medicare. The premiums for a UC-sponsored Medicare plan go down significantly, and thus so do the retiree's medical premiums. In this example, the monthly premium for Kaiser Senior Advantage is $500 per month, and UC's contribution at 100% is $640. Under Example A, a retiree receiving 100% of UC's contribution would have no monthly premium for their medical plan. In addition, since UC's contribution exceeds the medical plan premium, the retiree is eligible to receive the difference of $140, which would be added back to their UC pension check to offset the cost of Medicare Part B. In the other examples, while there is no Part B reimbursement, the monthly premiums are significantly reduced compared to a non-Medicare plan. Here's a recap of your Medicare and UC premiums. Medicare Part B and D, if you have a higher income, will be automatically deducted from your Social Security check if you're receiving Social Security income, or billed to you directly if you're not yet receiving Social Security income. Your UC medical, dental, and legal premiums will be deducted from your UC pension, and if eligible for a Part B reimbursement, this will be added back to your pension. Vision, accidental death and dismemberment, and pet insurance are voluntary in retirement. If you wish to continue coverage under these voluntary plans, you'll need to enroll directly with and pay the premiums to the plan administrators. Next, we'll explore the transition into retirement and beyond. Let's take a moment to review your transition from employee benefits to retiree benefits. Enrollment in UC retiree, medical, dental, and legal plans occurs as part of the retirement process. Since you'll be transitioning from active employee health coverage to retiree health coverage, you will receive new medical ID cards whether you are Medicare eligible or not. Since you will receive new medical ID cards in retirement, we encourage folks to refill any prescriptions and make any necessary appointments before retirement. If you or a family member is Medicare eligible at or after retirement, then they'll need to enroll in Medicare Parts A and B through Social Security and then complete the appropriate U-Bend form, send it to the RASC in order to coordinate enrollment in Original Medicare with their UC Medicare plan. If you move during or after your retirement from the UC, it's helpful to understand what plans are available to you geographically depending on your location. Let's begin with the non-Medicare plans. If you reside in California and are in a plan participating service area, UC Blue and Gold HMO, Kaiser HMO, UC Care PPO, Core PPO, and the Health Savings Plan are your plan options. Please note that coverage in the Health Savings Plan must continue from employment and you cannot newly enroll in this plan. If you move outside of California and remain in the U.S., then your plan options would be UC Care PPO and Core PPO or the Health Savings Plan. Finally, if you reside outside of the U.S., then your plan options would be UC Care PPO or Core PPO, as each of these plans provide international coverage. If you're Medicare eligible and reside in California and are in a plan participating service area, UC Medicare Choice, Kaiser Senior Advantage, UC Medicare PPO, UC Medicare PPO without prescription coverage, and UC High Option are your plan options. If you move outside of California and remain in the U.S., you have some family members enrolled in Medicare and some who are not, your plan options would be UC Care PPO, UC Medicare PPO, or Core PPO and UC Medicare PPO. If you move outside of California and remain in the U.S. and all family members are in Medicare, then you'll move to the Medicare Coordinator Program administered by VIA Benefits. We'll take a closer look at the Medicare Coordinator Program in the following slides. Finally, if you're Medicare eligible and you move or reside outside of the U.S., then your plan options would be UC Care PPO or Core PPO, as Medicare is not available outside the U.S., and UC Care PPO and Core PPO plans both offer international coverage. We briefly introduced the concept of split families in the previous slide. A split family refers to a retiree who has both Medicare eligible and non-Medicare eligible family members. If you have a split family, your non-Medicare family members remain in the non-Medicare plan, and your Medicare eligible family members transition to the partner Medicare plan of the non-Medicare plan. If you're enrolled in the health savings plan and you or a family member ages into Medicare, you must switch to a plan above that has a partner Medicare plan. I'd like to take a moment to expand more on the Medicare Coordinator Program. This program applies to retirees and their spouses or domestic partner who are 65 or older, enrolled in Medicare, and live or move outside of California but remain in the U.S. If you move, you'll need to notify RASC and update your address change in UC RAISE. RASC will then notify via benefits the administrator of the Medicare Coordinator Program of your move. Via Benefits will then do outreach to you and work with you and your spouse or domestic partner to find a Medicare plan in the state, county, or city in which you live that best fits your individual needs. For retirees eligible for the maximum UC contribution toward retiree health, UC will contribute $3,000 per individual, up to $6,000 for each Medicare eligible family member towards a health reimbursement account. Retirees not eligible for the maximum UC contribution will receive a prorated HRA contribution. You may use your HRA funds to pay premiums, out-of-pocket expenses, prescription medication, and more. Any unused funds roll over each year. Other benefits available in retirement include vision, accidental death and dismemberment, and pet insurance, which are all voluntary at the time of your retirement. If you wish to continue this coverage, you'll need to complete your enrollment directly with VSP, Prudential, and Nationwide. Please note that accidental death and dismemberment benefits are reduced to a maximum of $250,000. For homeowners, renters, and auto insurance, you'll continue to pay your premiums directly to California Casualty or Farmers. Employee benefits that end at retirement include life insurance and supplemental health. However, Prudential may provide conversion or portability options, so you'll want to contact Prudential for more information. If you have a flexible spending account, this will end on the last day of the last month that you contributed. UC and employee paid disability will end on the last day of work. By law, the UC is required to send out a COBRA notification packet following termination of employment. When you retire from the UC and your employee benefits end, you will receive a COBRA plan termination packet in the mail. If you are eligible for retiree health benefits or do not need COBRA continuation coverage, you can ignore the medical plan termination letter and disregard the COBRA notification packet. If you are not eligible for retiree health and would like to elect COBRA continuation of coverage, you can access the monthly rates on UCNet. If your separation or termination from the UC is due to your retirement, then your employee benefits will end on the last day of the following month that you separate. If your separation date is June 28, 2024, and you elect a July 1 retirement date, then your employee coverage ends on July 31st, 2024, and your retiree health and Medicare, if eligible, would begin on August 1st. If your separation or termination is not due to your retirement, then your employee coverage ends on the last day of the month that you separate. If your separation date is June 28, 2024, then your coverage will end on June 30th of 2024. If you're not eligible for UC retiree health benefits, you need to consider alternative options of coverage. Do you qualify for health benefits under a family member, including a UC spouse or domestic partner? Are you eligible for Medicare? Will you qualify for COBRA, which provides continuation of coverage for up to 18 months? Or explore plan options through Covered California or an individual insurance plan. Can you change medical plans when you retire? Retirement itself is not a qualifying life event to change plans. However, there are some life events that can occur which may allow a member to switch plans mid-year. This could include moving outside of your current plan service area, getting married or entering a domestic partnership, adding a newly eligible dependent such as a child, grandchild, or an adoption, or experiencing an involuntary loss of other coverage. If you have other health insurance coverage at retirement, such as through a spouse or a new employer, then you may waive your UC retiree medical and dental coverage and re-enroll during the annual open enrollment period, or if you experience a qualifying life event. If you don't experience a qualifying life event mid-year, then you will have an opportunity to switch plans during the annual open enrollment period, which takes place in October and November. Will your premiums increase once you retire? As an employee, your health premiums are based on your salary band. As a retiree, your health premiums are based on the following criteria: which medical or dental plan you are currently enrolled in, who you are covering under your plan, whether or not you or your family members are eligible for Medicare, and your retiree health group and how many years of retiree health service credit you have. Retirees eligible for 100% of the UC contribution can view the retiree medical plan cost page on UCNet for the 2024 rates or the UC Davis Retiree Estimator tool if they have graduated eligibility. What about survivor benefits? Your eligible survivors may continue health benefits in medical, dental, vision, accidental death and dismemberment, or legal if the following apply. They are enrolled or eligible to be enrolled as a family member in the UC-sponsored plan. They're receiving a monthly survivor income from UCRP, and the monthly benefit becomes payable 120 calendar days of the retiree's death. In the event your survivor does not qualify, their coverage will end on the last day of the month of the retiree's death. They may elect continuation of coverage through COBRA, or they can convert their UC-sponsored medical plan to an individual plan. Who are eligible survivors? You cannot choose the survivor eligible for post-retirement survivor continuance. Eligible survivors are defined by UCRP in the following order: your spouse or domestic partner, if you have been married or in a domestic partnership for at least 1 full year prior to retirement. To verify, UC requires a copy of your marriage certificate, registration of domestic partnership, or UBEN 250 Declaration of Domestic Partnership form, along with 2 pieces of evidence showing financial interdependence. Your eligible children under age 18 or under age 22 if a full-time student or disabled. Any disabled child must have become disabled prior to age 18 or 22 if in school full-time. For members in the 2013 modified 2013 or 2016 tier, there is no built post-retirement survivor continuance to receive health benefits as a survivor. You must elect an alternate payment option and name your eligible survivor as a contingent annuitant. While Savings Choice participants can be eligible for UC retiree health benefits and continue to cover eligible family members, those benefits end upon your death as there are no survivor income benefits payable. In this section, we will dive into a high-level overview of the cost of care under the UC Medicare plans. First, let's look at the UC non-Medicare plans. The UC non-Medicare plans are the same as the employee plans. This means your coverage, cost of services, and plan administrators remain the same. What does change are your premiums, as the premiums you pay for the non-Medicare plans are calculated based on your retiree health group, retiree health service credit, and UC's contribution for which you are eligible to receive. The UC offers both Medicare Advantage and Medicare Supplement plans. Under a Medicare Advantage plan design, you assign your Medicare to a Medicare-approved insurance carrier that must follow strict rules set forth by Medicare. Whenever you visit your doctor will bill your insurance carrier directly. Under a Medicare Advantage plan design, you do not have a deductible and you pay co-pays for services. UC offers two Medicare Advantage plans. UC Medicare Choice Plan, administered by UnitedHealthcare, is a Medicare Advantage PPO plan design. This means you have the flexibility to see both UnitedHealthcare and Medicare providers, and you do not need a referral to see a specialist. The Kaiser Senior Advantage Plan, administered by Kaiser Permanente, is a Medicare Advantage HMO plan design. This means you must stay within the Kaiser network, and referrals are required to see a specialist. Under UC Medicare Choice and Kaiser Senior Advantage, each of these plans include a Part D prescription drug component, so you do not need to enroll in a separate Part D plan. Please note that enrolling in a separate Part D plan can result in the loss of UC coverage. Here's a brief summary of the cost of services you can expect to pay under UC Medicare Choice and Kaiser Senior Advantage. As previously mentioned, you do not have a deductible and you pay co-pays, which is a fixed amount for services. Under both UC Medicare Choice and Kaiser Senior Advantage, you would pay a $20 copay for an office visit and a $65 copay for the ER. The annual out-of-pocket maximum is $1,500 per member per year. Here's a brief overview of what you can expect to pay for prescriptions under the UC Medicare Choice PPO plan and the Kaiser Senior Advantage HMO plan designs. Again, both UC Medicare Choice and Kaiser Senior Advantage include prescription coverage, so you do not need to enroll in a separate Part D plan. UC offers three Medicare Supplement plans: UC Medicare PPO, UC Medicare PPO without prescription drug, and High Option PPO. Each of these plans are administered by Anthem Blue Cross. Under the Medicare Supplement plan design, Medicare is the primary payer and Anthem pays secondary. Under this plan design, you pay deductibles and co-insurance for services. Since Medicare is a primary payer, you must use Medicare providers for most services. Non-participating providers, which is a provider who does not accept assignment, can charge up to 15% more. Providers who opt out of Medicare, meaning they choose not to work within the Medicare program, are not covered. Like UC Medicare Choice and Kaiser Senior Advantage, UC Medicare PPO and High Option both include Part D prescription drug coverage, so you do not need to enroll in a separate Part D plan. Please note that enrolling in a separate Part D plan can result in loss of UC coverage. The UC Medicare PPO without prescription drug is the only plan the UC offers that does not include a Part D component. If you enroll in UC Medicare PPO without prescription drug, you must enroll in a Part D plan and provide proof of enrollment to the RASC. Let's explore how the UC Medicare PPO, UC Medicare PPO without prescription drugs, and the High Option are different. The only difference between UC Medicare PPO and UC Medicare PPO without prescription drugs is that the UC Medicare PPO without prescription drugs does not include a Part D drug component. Outside of this, everything else is the same. Under these plans, you have an annual $100 deductible with an annual out-of-pocket maximum of $1,500 per member. As secondary to Medicare, Anthem pays 80% after Medicare for most services under these plans. Medical coverage under the UC High Option is also the same as the UC Medicare PPO plans. However, what is different is your deductible and out-of-pocket maximum. Under the High Option, you have an annual $50 deductible and a $1,050 per member annual out-of-pocket maximum. Additionally, under the High Option plan, Anthem pays 100% after Medicare for most services. In the next slide, we'll look at an example of how claims are processed with Medicare as the primary payer and Anthem as the secondary payer. Here's an example of how Medicare coordinates with the UC Medicare Supplement plans, UC Medicare PPO, and High Option. Medicare's allowable amount for an office visit is $150. Under Original Medicare, Medicare pays 80% of the allowable amount, which is $120. With Original Medicare, your out-of-pocket cost for the office visit is $30. As a secondary payer, Anthem pays 80% under the UC Medicare PPO plan, which brings your out-of-pocket cost for the office visit to $6. Under the High Option plan, Anthem pays 100% after Medicare, which brings your out-of-pocket cost for the office visit to $0. Here's a brief overview of what you can expect to pay for prescriptions under the UC Medicare PPO and High Option plans. Prescription coverage is based on a tier system that ranges from 1 to 4. Prescription coverage for these plans is the same. For additional information about the cost of care, including prescription drug coverage, check out the Which Medicare Plan is Right for You booklet available on UCNet. Let's take a moment to recap dental and vision coverage in retirement. Dental insurance will continue in retirement provided you elected it during the retirement process. If you are eligible for the maximum UC contribution toward retiree health, then your dental premium will be paid in full by the UC. If you have graduated eligibility, meaning you are eligible for a percentage of the UC contribution, you pay the difference. If you have a dental premium, it will be automatically deducted from your UC pension. Vision insurance is voluntary at retirement. To continue coverage, you must enroll directly with VSP and pay the premiums to VSP. You can view the retiree vision rates on UCNet. Life doesn't stop in retirement, and you may at some point experience a life event that allows you a mid-year plan change, such as a marriage, out-of-area move, or involuntary loss of coverage. If you experience a mid-year life event, you have 31 days from the date of the event to complete the UBEN 100 form and send it to the RASC to make a change to your retiree health benefits. If you don't experience a mid-year change, you can always make a change during the annual open enrollment period, which takes place in October and November of each year. All changes made during open enrollment are effective January 1st. Here is a list of resources we covered throughout the presentation. As a UC retiree, you may continue to access and leverage these resources. Furthermore, as you plan and prepare for retirement, use this as a guide to better navigate and educate yourself so you can continue to get the most out of your UC benefits in retirement. On behalf of the University of California, thank you for attending this webinar. Thank you for your years of service, and best wishes to you for a long and prosperous retirement.